Identifying schizophrenia in individuals who are also deaf can present unique challenges due to the overlapping symptoms and communication barriers. However, with careful assessment and consideration of the individual's specific circumstances, it is possible to make a diagnosis. Here are some key points to consider. Collaboration with a sign language interpreter. When assessing a deaf individual for schizophrenia, it is crucial to involve a qualified sign language interpreter or a professional experienced in communicating with deaf individuals. This ensures effective communication during the evaluation process. Medical history and physical examination. Begin by gathering the individual's medical history, including any previous diagnoses, medications, and family history of mental health disorders. Conduct a physical examination to rule out any potential physical causes for the symptoms. Psychiatric evaluation. A comprehensive psychiatric evaluation should be conducted, taking into account the individual's unique communication needs. The evaluation will typically involve gathering information about the individual's experiences, thoughts, emotions, and behaviors. Adaptations, such as using written or signed communication, may be necessary to facilitate the assessment. Diagnostic criteria. Schizophrenia is typically diagnosed based on specific diagnostic criteria outlined in widely used classification systems like the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, or the International Classification of Diseases, ICD-11. The assessment should aim to identify the presence of characteristic symptoms, such as hallucinations, delusions, disorganized thinking, disorganized behavior, and negative symptoms, e.g., reduced emotional expression or motivation. Differential diagnosis. It is important to consider other possible causes for the individual's symptoms. Conditions such as mood disorders, language disorders, or communication difficulties related to deafness may sometimes present with symptoms similar to schizophrenia. A thorough evaluation will help differentiate between these conditions. AYJNISHD at Mumbai provides psychological evaluation to the deaf and hard of hearing. Multidisciplinary approach. Given the complexity of diagnosing schizophrenia in deaf individuals, a multidisciplinary approach is beneficial. Collaborating with professionals from various fields, such as psychiatry, psychology, audiology, and deaf education, can provide a more comprehensive understanding of the individual's situation and help inform the diagnosis. It is worth noting that the diagnostic process may take longer and require additional adaptations when working with deaf individuals. Tailoring the assessment to their unique needs ensures accurate identification and appropriate support for both schizophrenia and deafness. If you have any problems like tinnitus or noise in the ear, please come to AYJNISHD, Mumbai for early diagnosis and management inputs. Thanks for watching.